Hey guys, Jessica again. So now we've talked about skin integrity. Now we're going to talk about wounds. Ugh, my favorite thing. Actually, no. Just talking about them makes me kind of ill, but I'm doing this to help you out. So I hope you enjoy and appreciate the fact that I'm grossed out. And I couldn't even look at the pictures on our slide. I had to cover them because it bothered me so much. And then my friend loves them and she gets all excited because she wants to see it and she can't wait. So different strokes for different folks. Pressure ulcers. It's any lesion that's caused by unrelieved pressure that can result in underlying tissue damage. So if there is pressure on their arm, the patient's constantly laying on their side, you're not turning them, they can develop a pressure ulcer on the tissue. It's usually over a bony area, so you're going to see more of a pressure ulcer over like the elbows, the backs of the knee, possibly the heels. The back of the head is a huge one that a lot of people miss. It can be related to a device, so if they have like a brace on or something, and it's a result of pressure. So there's different stages to a pressure ulcer. Stage 1, your skin's intact. It may be a little bit red, but it's like if you saw like a little redness from, like if you put your elbow on your leg for a while and you remove it, there's a red spot there, it will go away. That's kind of what you see in stage 1. The skin's intact, it's red, it may feel a little spongy, it may be a little painful or itchy. You would possibly suspect that there's a deeper tissue injury because of the look of it, but you should not massage it or do anything. You just kind of leave it be. A lot of them possibly will go away on their own. If it hits stage 2, that's where the skin starts to open. There's a partial thickness skin loss. So it kind of looks a little shiny, dry, shallow. The color would be pink, red, and it could be swollen. So then there's stage 3. There is no pain in stage 3. Why? Because it's gone deep. So you're going to feel pain in stage 1 and stage 2. Stage 3, there is no pain because it has gone through like the nerve receptors and you don't feel a thing. Huge risk for infection. What is the wound like? Nasty. You're going to see tunneling. You're going to see possibly a fistula, undermining. They may have an infection. You may see necrotic tissue. And here is the stage where you're going to see eschar, E-S-C-H-A-R. That is black tissue. Stage 3, black tissue, eschar, no pain, gross. Stage 4, it is full thickness by this point. It is all the way down, generally to the bone or the muscle or the supporting structures that it's in. You have a high risk for sepsis, and that is like an infection in the blood, very serious. It generally will kill your patient, so you got to watch for that. There is no pain because the nerve roots have been eaten through basically or worked through, but you will see tunneling, you could see a fistula, you could see exudate, extra stuff on there, and generally an infection. So your 4 stages, let's go back over them again because you need to know this. So stage 1, there's just redness, the skin is intact, it may feel a little spongy, maybe a little itchy red spot. You would suspect that maybe there's a deep tissue injury, like a bruise or something. You wouldn't really suspect a pressure ulcer. If it's stage 2, it's starting to open, partial thickness lost, it's shiny, dry, and shallow. It could be painful at this stage as well. The color of the surrounding skin would be pink, red, and swollen. Stage 3, no pain. Risk for infection, eschar, black nasty tissue. You're going to start to see tunneling, possibly undermining. They may have an infection at that point. Stage 4, you need to know this, full thickness. There it is down to the bone, to the muscle, to the structures. Is there pain in this stage? No, because it has gone and worked through all your nerve receptors and it's all the way down to the bone, so they don't feel it. And that's the thing, a lot of them, if they don't feel it, they're not going to know necessarily that it's there, and they're not going to know that it's infected or got problems. So that's where you need to come in and really be watching wounds. High risk for sepsis in stage 4. You could see a fistula, tunneling, exudate, but remember, stage 3 and stage 4, no pain. So I made it through, I didn't pass out, and I talked about wounds, yay! So I hope you enjoy.